Hello. This is Cosmo Himeka. Thank you for watching. I want to know if I work on health. Dementia Manual. It is said that at the age of 8 million people with dementia, the increasing trend of the family is expected to continue in the future. Dementia that is not individual. Health service professionals want to know. I summarized the basic knowledge. Symptoms of dementia gradually progress from 20 years before the onset. Start prevention in your 40s, 50s, and 60s. It's late after the onset. What is dementia? Dementia is because intellectual function is continuously reduced due to brain damage. It has become an obstacle to family life and social life. It refers to the state in which human assistance is needed. Anyone who loses control of medicine, money, or clothing will know that they have dementia. But if it's lighter, it can be overlooked because of age. For example, I can't cook well. Even if you can no longer use your mobile phone or email, it can be said that there is a high possibility of dementia. Types and causes of dementia. Dementia depends on the cause. There are also types of dementia. Alzheimer's dementia, which is common among Japanese people, accounts for about 70%. Other than Alzheimer's dementia. Cerebrovascular dementia about 10%. Lewy body dementia is 1. It is said to be about 10%. Alzheimer's disease. There is a small amount of protein called amyloid beta protein, A-beta, in our brain. Amyloid beta protein made in the brain. Because it exists in a melted state and is immediately decomposed and removed. Harmless to the brain under normal conditions. However, when the solution removal function deteriorates due to aging or other causes, amyloid beta protein accumulates in the brain. If it becomes excessive, it will form a mass. Hardened amyloid beta protein can damage nerves. This wound caused it to dissolve in nerve cells. A protein called tau also begins to solidify. Nerve cells die one after another, and Alzheimer's dementia develops. Symptom characteristics. Because Alzheimer's disease begins in the hippocampus, the center of memory, and related areas, there is a feature that starts with forgetfulness. Kaiba is a place to temporarily store recent memories, so you will forget what happened just before. Furthermore, I don't know the date and place. Disorientation. Symptoms such as being unable to cook or shop appear. Executive dysfunction. Also, the parietal lobe, which is involved in spatial recognition, is strongly impaired. Construction disorder. I can't draw a picture of the clock, or I get lost. As it progresses further, behavioral psychological symptoms such as hallucinations, delusions, and wandering will be seen. Vascular dementia. When cerebral blood vessels become clogged or torn due to arteriosclerosis or high blood pressure. Not enough blood reaches the brain cells in the area controlled by the blood vessels. Partial loss of brain function. Dementia can occur when these lesions form throughout the brain. Therefore, cerebrovascular dementia is triggered by cerebral infarction, cerebral hemorrhage, subarachnoid hemorrhage, etc. It happens relatively suddenly and gets worse in steps. In addition, since the arteries of the brain enter vertically from the surface of the brain and become thinner as they go deeper, blood flow tends to be interrupted as they go deeper. Deep white matter degeneration occurs as blood pressure drops at night. And it may take a gradual course. In all cases, vascular dementia includes hypertension, diabetes, dyslipidemia, smoking, etc. Often found in people who have risk factors that promote arteriosclerosis. Symptom features. Symptoms of the area where the cerebrovascular accident has occurred will appear, but the brain function will be maintained where the disorder has not occurred. It is also called mottled blur. In addition, the frontal lobe is easily damaged, so the decrease in motivation and spontaneity is noticeable. In addition, it is often associated with physical symptoms such as gait disturbance, paralysis of limbs, slurred speech, and dysuria. Depressive symptoms, nocturnal delirium, agitation, etc. are also common. Lewy body dementias. Lewy body dementias for some reason. Dementia is caused by the solidification of a protein called alpha-synuclein. This mass is seen as a spherical structure in nerve cells of the brain. This is called a Lewy body, named after the discoverer. Symptom features. The big difference from Alzheimer's disease. With hallucinations or Parkinson's symptoms from the beginning. Even though there are no hallucinations, there are many calico cats. Specifically express that there is a small girl. In addition, depression, autonomic nervous system symptoms, dreaming and yelling. There is also a characteristic that the intensity of symptoms varies from day to day, and even during the day, depending on the time. Other dementia. Frontotemporal dementia. Normal pressure hydrocephalus. Chronic subdural hematoma. Argyrophilic grain dementia. Neurofibrillary tangle dementia. Hippocampal sclerosis. Dementia can be prevented. Pre-stage of dementia. Mild cognitive impairment, MCI. Dementia, especially Alzheimer's disease, is not sudden. Since it occurs gradually, there is a gray zone between normal times and when the disease becomes apparent. The stage where forgetfulness is becoming more intense but not yet dementia is called mild dementia disorder. In English, it is called mild cognitive impairment. This acronym is called MCI, mild cognitive impairment. Most mild dementia disorders develop into dementia. Some return to normal or do not transition to dementia. Can stop with mild dementia disorder. Lesions have occurred 20 years before the onset of illness. Recent studies show that brain lesions in Alzheimer's disease. It has been found that it will start 20 years before the onset of illness. Amyloid beta protein hardens and begins to damage nerve cells. I knew it was about 20 years before the onset of illness. There is almost no forgetfulness these days. Even if there is something that is said to be due to age. This period is called the asymptomatic period of Alzheimer's disease. Eventually, forgetfulness becomes stronger and it is time for mild dementia disorder. As it progresses further, symptoms of dementia due to Alzheimer's disease appear. Alzheimer's disease often develops in the 70s and 80s. It is thought that amyloid beta protein begins to solidify in the brain in the late 40s, 50s, and 60s. It's late after the onset. When dementia develops, based on a doctor's diagnosis, treatment such as medication and rehabilitation begins. Currently, there are drugs that slightly improve the symptoms of dementia and slow the progression. There is no cure to stop the disease and cure the disease. Because when you get sick, your brain is shattered. Therefore, if changes in Alzheimer's disease appear in the brain, detect them as soon as possible. Need to take action. From asymptomatic to mild dementia disorder. It is the best time for prevention and needs to be continued. For early detection of dementia. The reason why early detection is important for dementia. This is because it is possible to improve and prevent in life if it is very early. The time of mild dementia disorder can be estimated to some extent by forgetting things, but being stronger than others. But in the asymptomatic period before entering mild dementia, everyone forgets. It's hard to notice this because it's age appropriate. If you have symptoms that seem to be mild dementia disorder, we recommend that you visit a forgetfulness outpatient clinic. If you are asymptomatic, try to change your lifestyle so that you are less likely to have dementia. Mild dementia disorder. Early detection list. More and more people forget about recent events. The taste of the food I make has changed. The room is cluttered with things and garbage not being cleaned up. I don't notice the smell. How to choose clothes is different. I wear a coat even though it's summer. I try to go out in my pajamas. I no longer care about my appearance. I stopped wearing makeup. Avoiding interaction with people and staying at home more often. My mood became more uneven and I became emotional. More yelling. Dementia early detection test. Amyloid imaging. Amyloid imaging test binds to eV-liter mass. Inject a chemical with a radioisotope. The image is taken with a machine called PET. PET that everywhere because the machine is expensive. I can't take this test. Recently the causative agent of Alzheimer's disease. Amyloid beta protein clumps. Technology has been developed to capture images of deposits in the brain. It has been put to practical use overseas, but it is still in the clinical trial stage in Japan. Cerebrospinal fluid test. It is a method of collecting spinal fluid by piercing a needle from the waist and measuring the amount of elevator and tau in it. Cerebrospinal fluid amyloid beta protein 42 has been decreasing for 20 years before the onset of Alzheimer's disease. This decrease in amyloid beta protein 42 means that the amyloid beta protein is clumped together. Means that it has begun to accumulate in the brain. Tau will increase with a delay of about 10 years. Means that nerve cells have begun to break. Blood test. Because it is difficult to pierce the needle from the waist and remove the spinal fluid, a method for ultra-early detection in blood has also been developed. By measuring some proteins in the blood, there is an inspection method that develops a highly sensitive diagnostic method and accumulates data. Very early diagnosis. Precautions for use. People with Alzheimer's disease in the future will be asymptomatic. These changes are already appearing. Because there is no radical preventive drug yet, it is not recommended that asymptomatic individuals undergo these tests. You will receive it only for research or as a reference for your own life planning. If you receive it for your own future, like the human doc and brain doc, there is no insurance coverage. Can be done immediately. Preventive measures for dementia. Dementia prevention is never too early. Start dementia prevention measures today. Aging measures for the whole body are also measures for dementia. Major risk factors and suppressors of dementia. I want to improve immediately. Risk factor. Aging. Lack of exercise. Obesity. Smoking. Diabetes. Unbalanced diet. Dyslipidemia. Hyperlipidemia. Head injury. Low education level. Excessive alcohol intake. High blood pressure. Excessive stress. Depression. Genetic factor apolipoprotein epsilon, epsilon, 4. Inhibitors you want to incorporate into your life right now. Exercise habits. Hobby activities. Social participation. Diet rich in vitamins and minerals. Green and yellow vegetables. Mediterranean cuisine. High education level. Nap for less than 30 minutes. Dementia is one of the lifestyle-related diseases. Among dementias, Alzheimer's disease and vascular dementia, especially highly related to lifestyle-related diseases such as obesity, hypertension, diabetes, and dyslipidemia. Preventing lifestyle-related diseases will prevent the onset of dementia. Can be prevented in daily life before the onset. The greatest risk factor for dementia is aging. Also, lifestyle-related diseases such as sluggishness and diabetes. It is a big risk factor. On the other hand, exercise, intellectual activity, hobbies, social fellowship, fish, and green and yellow vegetables, vitamin E and vitamin C. It is a suppressor of dementia. Reduce risk factors in life. By actively incorporating suppressors, can prevent the onset of dementia to some extent. Therapeutic drugs only slow the progression. It has the effect of improving symptoms and delaying the progression of Alzheimer's disease. Acetylcholinesterase inhibitors and glutamate receptor antagonists can now be prescribed. Contributes to improving the QOL of patients and reducing the burden on caregivers. However, these have no radical preventive and therapeutic effect and the progression of the disease is unavoidable. Also, these drugs can only be prescribed after the onset of dementia. Cannot be prescribed for mild cognitive impairment or asymptomatic. Recent studies have shown that Alzheimer's disease has been around for 20 years. It turns out that pathological changes in the brain have started, and at the start of treatment after the onset. It is already late, and it is said that early detection, prevention, and treatment are important. The Ministry of Health, Labor, and Welfare has also introduced short-term concentration of dementia and rehabilitation addition. We are focusing on prevention. From April 2015, food functionality labeling has been approved. Efficacy display is now possible for supplements. However, nothing is in the stage of trial and error. What kind of program is good? By what supplement? The reality is that we don't know if we have high evidence. Summary. Dementia can be prevented. If you have a lot of forgetfulness, prevent it immediately. Most people say because of age. I give up and accept without worrying too much. By preventing at that time, it can slow the progression of dementia. Dementia does not cause much trouble for the person. It is a symptom that involves family members and people around them. With an average age of 80, dementia prevention is needed for everyone. I can't stop aging. Delaying can be easily done with your own little effort and consciousness. Japan, where health education is delayed. Acquire correct knowledge on a daily basis. It is necessary to acquire a healthy lifestyle from a young age. I'd love to. Please refer. Cosmo Himeka. If you work on health, you should know Dementia Manual. Thank you for watching Cosmo Himeka. I will deliver the things I was interested in. If you like, please press the channel button.